Hello everyone, my name is Kanhana. I will be talking about the diaphragm contraceptive methods. So, what is the diaphragm? The diaphragm is a shallow, dome-shaped cup with flexible rims. It is made of silicone that is inserted into the vagina. Diaphragm covers the cervix, preventing sperm from joining with an egg. The diaphragm must be used with spermicide cream or gel. The diaphragm blocks the uterus while spermicides stop the sperm from moving. One diaphragm can last up to 2 years. Using a diaphragm is safe, simple, and convenient. You can fit a diaphragm in your purse. It can be used during breastfeeding. It has no effect on women's natural hormones, and it is immediately effective and reversible. Like all birth control methods, diaphragm is more effective when used correctly. When using diaphragm as directed, only 6 out of 100 women become pregnant each year. With little practice, the diaphragm is easy to use. Your healthcare provider will show you how to insert and remove your diaphragm. First, wash your hands with soap and water. Put about a tablespoon of spermicide in the cup and spread around the rim. You should choose a comfortable position, either squatting or standing with one foot up. Separate the lips of your vulva with one hand and pinch the rim of the diaphragm to fold it in half with the other hand. Place your index finger in the center of the fold, then push the diaphragm as far up and back in your vagina as possible, making sure your cervix is covered. When removing the diaphragm, hook a finger over the top of the rim to break the suction, then pull the diaphragm down and out. The diaphragm must stay in place for 6 hours after vaginal intercourse. If having intercourse again before 6 hours, you can insert more spermicide deep into your vagina and leave the diaphragm in place. Do not leave the diaphragm in for more than 24 hours. After you remove the diaphragm, wash it with soap and warm water. Do not use powder or oil-based lubricant as they can cause infection and damage the silicone. Also, look for holes and weak spots on the diaphragm. To obtain a diaphragm, you can visit a healthcare provider. You will be examined, and your provider will find a correct size diaphragm for you and will give you a prescription for the diaphragm. The cost of the examination is between $50 to $200. Diaphragms average from $25 to $75, and spermicide gel or cream costs from $8 to $17 a kit. The diaphragm may be difficult to insert. It may be pushed out of place by some penis size in certain sexual position, and it may need to be refitted. Some side effects include urinary tract infection and vaginal irritation. Diaphragm may not be right for you if you're not comfortable touching your vagina or vulva, are sensitive to silicone or spermicide, have frequent urinary tract infection, have poor muscle tone in your vagina, have recently given birth or had an abortion. Keep in mind that diaphragm do not protect against STIs. Talk to your healthcare provider to determine whether the diaphragm is right for you.